Regulation is done by multiple things, like we will be looking at regulation of heart rate is a complex process. It is controlled by autonomic nervous system, some of the hormones, and heart itself, and some other factors. What kind of the factors regulate the heart rate? Local mechanism like SA node is the pacemaker of the heart, generate rhythm, and it is located in the right atrium, sulcus terminalis. Nervous system has also contribution in the heart rate maintenance, like sympathetic nervous system is stimulation of heart rate with norepinephrine, and parasympathetic has decreased the system via acetylcholine and through potassium mechanism. So in this way, heart rate is maintained by sympathetic and parasympathetic nervous system. Sympathetic nervous system uses sodium and calcium. Parasympathetic nervous system using potassium for hyperpolarization, and results into the decrease in SA nodal firing rate and decrease in heart rate. So in this way, uh, another one is intrinsic heart rate is defined as the rate at which heart beats and all cardiac muscle are contracting. It is determined by IV administration like atropine and atenolol. So these drugs also maintain heart rate. Now, as you can see here in the medulla of the brain, there is acceleratory and inhibitory receptors. Sensory goes to the carotid sinus and carotid body. They send signal down to the earth or SA node and AV node, bundle branch, bundle of phase, and in this way, heart rate is maintained by these. Okay, so there is pulse pressure. Pulse pressure is difference between systolic and diastolic pressure. Means 120 minus 80 is 40. So pulse pressure is normally 40 to 30, and it is important to determine pulse pressure is stroke volume and pulse pressure. Narrow pulse pressure occurs in hypovolemia. There, hypovolemia decrease stroke volume, narrow pulse pressure, cardiogenic shock, cardiac tamponade, anaphylactic shock, and a wide pulse pressure occurs in septic shock, pregnancy, increased intracranial pressure, regurgitation, and aortic dissection. So, pulse pressure is the difference between systolic and diastolic pressure. Now, here we can see that the pulse pressure increase in the conditions like thyrotoxicosis or palpitation or any condition which increases stroke volume also increases the pulse pressure, like pulse pressure increase with capacitance increase, or it also capacitance of arteries decrease. Arteriosclerosis aging can also cause increase in pulse pressure. Any regurgitation of aortic valve, pulse pressure increases. Increased systolic pressure results into increase in pulse pressure, while pulse pressure decrease in a condition like shock, hypovolemia, and cardiogenic shock, or MI, or any constrictive pericarditis or myopathy, there is increase in pulse pressure. Jugular venous pressure, it is a pressure, jugular venous pressure which is present at the jugular vein. So that's known as jugular venous pressure. There are different waves formed in jugular venous pressure like A wave, X wave, Y descent, and V wave. So in this way, these waves have their own importance. Jugular venous pressure is clinical examination helpful pressure of the right atrium of the heart by observing the jugular vein on the neck, and also we use this pressure. Okay, so first heart sound and second heart sound is produced by when isovolumic contraction occurs. First heart sound open is formed when isovolumic relaxation happens. Second heart sound is created. So this is because of contraction of valves of the heart, which results into the form. Okay, so there is another very beautiful concept of preload. It is load of the heart or the blood which is received in ventricles. That's known as preload. Okay, so preload is a parameter refers to the degree of stretch of the atrium myocardium at the end of diastole. It is decreased by nitroglycerin or any vasodilator. Afterload is the quantity of afterload is the pressure of the heart's ventricle must overcome to eject blood into the arteries during each contraction. So in this way, afterload is okay. So here is a clinical importance. Iron, potassium ion increases extracellular fluid. When it increases, heart rate become dilated impulse transmission of AV bundle blocks, heart become weak, rhythm become abnormal, and these events lead to death. So potassium is very important to monitor, especially in heart failure patients. Calcium ion, when increases, causes increased contraction of the heart, when decrease causes cardiac flaccidity. Sodium ion increases results in depressed cardiac contraction, and it is because of sodium competes calcium in contractile channels, so which results into decrease the contraction of the heart. Another one is temperature. A moderate increase in temperature increase contractility, while decrease results in decrease in the contractility. So these ions have different role in the function and the contraction of the heart. Now arteries have three layers: tunica, intima, media, and adventitia. When there is any dilation or any absence of medial layer of artery, which results in the very aneurysm, and it is associated with polycystic kidney disease and very aneurysm. Tunica adventitia's outer layer baroreceptors are located in adventitia, and it has also role in the maintenance of blood disease. It is a condition in which there is different findings of the heart are there. Patient will have carditis, arthritis, subacute nodule, erythema marginatum, cerium, chorea, rheumatoid heart disease. Another is minor criteria like patient will have fever, chest pain, raised ESR and CRP, joint pain, arthralgia, and prolonged PR interval in rheumatoid heart disease. Other findings will be ash of bodies will be present in the rheumatic patient, fever, inflammation, heart muscle pain will be there, ash of bodies and granuloma will be formed, fibrinoid necrosis and lymphocyte infiltrates will happen in the plasma, and multinodular giant cells will be there. Anti-show cell will be present, fish mouth or buttonhole stenosis will be there in the mouth mitral valve. Let me show you buttonhole stenosis of mitral. Here in this image there is fish and fish mouth, as you can see fish mouth, and the mitral valve is also showing fish mouth buttonhole stenosis of mitral valve. So this is why rheumatoid heart disease there are these findings, because in rheumatoid heart disease mitral valve is mostly involved. Another one is Meckelum plaque present in rheumatic endocarditis heart valve. Mostly mitral valve is involved in mitral regurgitation is most commonly present in uh, mitral regurgitation in fish valve or buttonhole deformity and rheumatic fever. Diagnostic criteria is blood culture is best investigation, and we will look at ASO titer for rheumatic heart disease, and patient will have fever, migratory polyarthritis, pain in joint, arthralgia, elevated ESR, CRP, C-reactive protein, heavy block, leukocytosis, mitral valve problems will be there in the patient, and also there will be left side heart failure or regurgitation results into the increased stroke volume, and then patient will be treated with certain. Another one is infection of heart endocardium, infective endocarditis. It is a condition in which there is infection results into congestive heart failure. If untreated, patient can die of this condition. What are findings of infective endocarditis? There are growth spot on the retina and intracranial pathologies. Patient will have pallor, stiff neck, arrhythmias will be there, pericardial rub, pericardial friction rub will be there, anorexia, weight loss, splenomegaly, and Janeway lesion will be there. These are non-tender macules on the palms and soles. So sphincter hemorrhage under fingernails, ossular node, painful Janeway lesion will be there, hypothenar eminence will be their problem, splenomegaly, and roth spot will be there in retinal hemorrhage. Vegetation is also there in the patient because of infection. That's why called infective endocarditis. Next one is Asthma syndrome. Asthma syndrome is a condition. Asthma syndrome Asthma syndrome is a condition in which there is left to right shunt, increased blood flow from left side to the right, pulmonary vasculature results in pulmonary hypertension, SOB, shortness of breath, and also patient will have reversal of the shunt from right to left can also happen, and then left side increased pressure results into the cooling of the blood into the vasculature of lungs. So In this way, it is associated mostly commonly with the ASD, VSD, or PTA, patent ductus arteriosus.